Hey, what's up, folks? It's Cecil again with your CBD Minute. Just reaching out once again, touching base, helping to educate folks so folks are able to learn more about CBD and you're able now to be able to benefit from CBD, but have those facts that make a huge difference. So today's topic, we're going to talk a little bit about the difference as far as dosage. A lot of folks are now trying to understand, how do I dose CBD? How do I know how to utilize it? What's best for me in regards to dosing? So a lot of what I do, just kind of giving background again, is I educate a lot of medical professionals and I educate a lot of folks in regards to how they can utilize CBD in their practice and whether it's medical professionals, pharmacies, or whatever it might be. And so a lot of people are always trying to understand, well, so all these products that are out there, how do I know that I can, the dosage in regards to utilizing CBD? So what I want to do right now is talk about what you're using CBD for. A lot of folks are using CBD for different reasons. They're focused on it for pain. They're focused on it because of sleep. Maybe they're having issues with anxiety or stress. Each thing that you're utilizing it for is going to have a different benefit. You're going to utilize different forms of CBD to get the results you're looking for. So the first thing that I want to make sure you understand is that your topicals are going to be more for muscle and joint pain, those type of things like that. Every so often there'll be some products that have other things added that'll give added benefit, that'll allow you for it to help for the long term. But you're going to utilize your topicals, such as your pain sprays, your ointments, oils, and so forth and so on, for things like joint or muscle pain. That's where you're going to utilize that. I wouldn't use it to solve or resolve chronic issues. So you can use it to help that. But as far as getting the best results and as far as dosing is concerned, for chronic issues, you're not going to use a topical for that purpose. What I would instead is I would use a topical in addition to taking something sublingual. So when it comes down to your dosing that you'll need for a sublingual, the first thing I want to make sure you understand is that you're going to need a substantial dosage, decent amount of dosage for you to get the results you're looking for. So what I like to do when I talk to clients and patients is I simply inform them and say, so you're going to think from the perspective of a 1-to-10 ratio. Think of it as if your pain is going to be between the areas of 1 and 10, and you're going to literally categorize it as a 5 or below, you should be able to deal with something at about a 500 milligram dosage to get you the results you're looking for. So a 500 milligram dosage should be able to get you what you're looking for if you're dealing with a situation where it's a pain level of 5 or below. If your pain level is 6 or 7, then I'm going to encourage you to probably go with about a 750 milligram to 1,000 milligram dosage. That's what I would encourage. Looking at the dosing, 1,000 milligram is probably the ideal right fit. Most folks will find they'll get substantial results and benefits from 1,000 milligram dosage. So 1,000 milligram is where I would then recommend next. If your pain is a 7 or higher, 8 higher, then you're going to look at the higher dosage, like a 1,500 milligram dosage and above. I'm finding that even though other companies and brands are offering a variety of different dosages that are really high, for the most part, you really don't need to necessarily have a very high dosage. If you're taking it even much higher than 1,500 milligrams for you to get the results you're looking for, to get the benefit from the product, especially if it's an isolate you're utilizing. You'll find that CBD is going to get you the benefit you're looking for. Even with those lower dosages, you may choose to take it more frequently during the day, but needing to take a high dosage at one time, higher than 1,500 milligrams, probably won't be necessary for you to get the results you're looking for. You may need to take it once in the morning, once in the evening to help you with sleep, or help you with pain throughout the day. But if you're dealing with something where you're dealing with the symptoms and issues that are associated with a cancer, I know folks that'll take it as many times as 3, sometimes even 6 times a day, because you're trying to help your body to be able to combat what chemotherapy is doing. So you'll take higher amounts, lower dosages, or like 1,000 milligram or 1,500 milligrams a number of times a day, maybe 2 or 3 times, maybe 6 times a day, depending on what dosage you're using, to consistently empower your body to be able to fight and be able to work along with the chemotherapy. So it just all depends on what you're looking at. But what I want you to understand is that the most important thing to realize is that you need to ensure that what you're using is pure CBD. What I mean by that is you need to make sure that it's third-party tested. Oftentimes, folks don't realize the power of having a third-party testing process, and not just a third-party process that simply tests one time, but they test every single batch. And so that's critically important, third-party tested, and then also make sure that it's grown here in the United States. We have other major stories and concerns that have come out as far as folks utilizing things that are grown in other parts of the world, and unfortunately, the same standards aren't there, and sadly, people have had adverse reactions as a result. So that's what I have for today. So again, with your dosing, just be mindful about the fact that, you're going to use that 1 to 10 kind of ratio to help you not 1 to 10 ratio, but that kind of scale to help you decide how much you'll need. And then also use that same scale for you to decide if you're going to use, if it's a chronic or if it's minor pains and aches that you can use topical, then topical is going to work, or use a topical in combination with the sublingual. The sublingual is going to get into the endocannabinoid system that'll benefit your body. So next week, we're going to talk about the endocannabinoid system and educate folks about what that is so people understand and how the science works for CBD. So that's it for today for Cecil with your CBD Minute. Thanks so much. And again, my website, if you want to check out what we're doing, is trycbd2day.com. Again, trycbd2day.com. Folks, have a blessed day. Thanks so much for watching. Bye now.